into a space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome back to the Confidence Doc podcast. I'm Dr. Rednam. I'm board-certified plastic surgeon in the Houston, Texas area. And I have an amazing guest today, one of my partners, Dr. Barry Fairchild. Welcome to the show.
Thank you so much for having me. Excited to be here.
So, Dr. Fairchild, tell us a little bit about what got you into plastic surgery.
Sure. So I would say I had a very nonlinear road to becoming a plastic surgeon. I grew up with my father, who was training to become a transplant surgeon, and had a very early exposure to the life of a surgeon, which definitely gave me some trepidation to enter surgery in general. So I initially actually studied nursing, and I was an ICU nurse for 3 years. During that time, I had continued exposure to the field of surgery and came to learn that I absolutely needed to pursue a surgical career for fulfillment. So that's how I ended up pursuing medical school, always with the goal of becoming a surgeon, but not really sure of what type of surgery interested me. So for that reason, I went into general surgery initially with a goal of becoming a vascular surgeon. I liked vascular techniques, the anatomy. And it was when I was in training that I had my first exposure to plastic surgery. And I found that there was actually a lot of crossover with techniques, anatomy, blood vessels, complex, movement of tissue. And I really liked the idea that plastic surgeons solve problems, and your work is, it's external, and you have immediate gratification, kind of helping put people back together. So that was really exciting for me. I also always say that plastic surgery or surgery is kind of my medium as an analogy to art. My father's a surgeon, my mother's an artist. So it was kind of a natural blend of those two worlds.
You're the perfect blend of them.
Thank you. Thank you.
So let me ask you, because you did take a nonlinear path, do you feel that having those years as a nurse has made you a better surgeon or given you a different perspective on things?
I definitely, I'm not going to say like better or worse, but I think that it helped form who I am. I think that it gave me a lot of insight into what goes on outside of the operating room, the journey that patients take before and after surgery, the interactions that they have with family members, with the medical system in general. It gave me just a wider perspective, which I think helped develop my empathy for the journey as a whole. And I tend to be a pretty empathic person by nature, so that's probably a plus and a minus, but it really, it feeds my excitement for taking care of patients.
I think that's wonderful. I think at the end of the day, the more that we have experiences that are all part of like being a team, the better it makes us. It gives us a, just like you said, a different view. We can be more empathetic as surgeons as well.
Absolutely.
So one reason I really wanted to have you on the show is because, I feel like you and I are definitely people that put ourselves out in social media from as plastic surgeons, as female plastic surgeons, and that has its pluses and minuses. So when you first were like, okay, I'm going to start doing this, what was your kind of goal? What were you envisioning your social media, the purpose of it to be?
I had no purpose and no goals going in. No, I would say I didn't exactly know the end goal, and still it continues to evolve. But I think in the current climate, at entering the current world as a new surgeon, it's so important to put yourself out there, to make yourself vulnerable in order to build a community and establish connections so you can build a practice.
Mm-hmm.
And so for me, I think, the older, more established surgeons didn't have social media, and the types of marketing that was available was much more narrow.
Mm-hmm.
I looked at social media as an opportunity to show people who I am and to develop relationships on a broad scale in a short amount of time.
And I think that what patients, so for potential patients, are looking for has changed too. It used to be, I want somebody good who's going to take care of me. And I still think that's very much what people want, but now they want somebody they connect with. They want someone that they feel is going to understand them. And so I think that that's where social media comes in, is that you may not be able to get that off of a website or off of papers published. In that case, you really kind of have to get to know that person.
Definitely.
What are some challenges that you've seen?
If you've been to my page, you know what my challenges are. I think that social media, while there's a lot of power to it, and I attribute a lot of my early success in my career to my traffic on social media.
Mm-hmm.
So I very much am thankful for that. It comes with quite a bit of negativity, and you really, while you open yourself up to a lot of positive connections, you also open yourself up to a lot of negative connections and a lot of critiquing from people that don't know you at all.
Mm-hmm.
It's sometimes I kind of feel like it's that bullying mentality, but opened up to like endless numbers of people.
Yeah.
And that it takes an adjustment to get used to it.
And I think, at the end of the day, that on social media, I follow you, and you really do. You're very authentic. You're very open about things when you've had a procedure or when you're discussing just in general about treatment plans you have for your patients. And I think for some people, they take that as, even though it's not, they take it as, oh, you're telling me that I need this or I need that. And that's not the case. I think with most plastic surgeons, social media, we're just trying to educate.
Of course.
Of
course. And it is, I think that there's always interpretations of what you're putting out there. And no matter how hard you try to be transparent and to tell your story, share your journey, some people, it might be interpreted by different people in different ways. And that I have to look at as out of my control. I try to put things out there that are helpful to the people that I am trying to talk to. And I have a lot of patients that ask me, what is important preoperatively? What can I expect after surgery? What are the short-term and long-term consequences of these things that I'm seeking? And so that's why I recently shared my journey with eyelid surgery, because I get those questions all the time. And sometimes I think that surgeons may tend to minimize some of the less glamorous parts of plastic surgery. I try to be transparent so my patients know what to expect. And I think that certainly can be interpreted as, everybody needs the surgery and minimizing and
it can be said too, right? I mean, people say this all the time, it's not that hard just to scroll by if you don't like the content.
Right.
Maybe it's just not for you. So I think that it's interesting as well that I feel like there is a little bit of a double standard on social media when it comes to male versus female plastic surgeons. And I'm curious what your thoughts are on that.
Yes, I agree. I agree. I think in general, globally, there's a difference. There's a double standard with women in the fields of surgery or any stereotypical male profession.
Yeah.
I think that we are now women are now carving out their place at the table in a lot of these more rigorous professions. And but the standard of you need to give 100% and be just as competitive and technically capable as your male counterpart, but you also need to have those womanly features. You need to make me feel good. You need to make me feel good. You need to be kind. You need to be empathetic. You need to be caring. You need to treat me, in a different way than you would expect a man to treat you.
Yeah.
And you also need to go home, take care of your children, give 100% at home. And it's just an unreasonable standard, in my opinion.
I agree with you. And I think that at the end of the day, I don't think as female plastic surgeons, we're asking for something more. We just simply want to be treated the same.
Right.
And I think it's hard because, like, from a social media aspect, I rarely ever see people trolling about the looks of their male plastic surgeon. It's usually like, you're fine, you're great. Or if they don't like them, they don't like them. But it's really much more common to see them pull apart us as women. I remember after my second daughter was born, I did a reel. I didn't look 100%, but I just had a baby. And somebody commented and said, I thought she would have looked better as a plastic surgeon. And I was just, it hurt my feelings. I'm a human being. And I was like, and I felt like I started feeling like I had to defend myself. And then I was like, you know what? I don't need to defend myself. Like, this person doesn't know me. And it doesn't matter. If you don't think I look good enough, then fine. But it didn't mean that it didn't for a minute go, ow, that hurt a little bit.
Right. No, it does. And when people attack like you as a person, it takes time to be able to brush that off. And I think that the more you experience it, the more you can rationalize that that's not my problem. And, I'm doing a good job and I'm doing my best, and I hope the best for them.
And I hope for our listeners out here, you see that, like, surgeons are humans too. And, we do put a lot of time and effort. Dr. Fairchild and I are both moms. We're full-time surgeons. And then we make all this extra time to create content for social media because we do want to educate and share with our patients and potential new patients. And it takes a lot of time and balance. And so it is hard when people are not kind. So
absolutely. I think there's also this underlying thought that, social media, like, that's fun. And
it can be
fun, but it's also on I'm like a huge checklist person, and it's on my to-do list. It does take effort, and you do need to really prioritize and fit it into your life without allowing it to take away from any of your more important things.
Yeah.
So that can be a challenge.
And I think it's a good part for people looking to learn more. It's a good part, like a part of their research journey, right? I don't think social media should ever be 100% how you're learning all of your information, even if it's from good sources. I think that there should always be kind of, you're doing web searches, you're looking at reviews. That's going to give you the full picture of who people are and not just a 1-minute video.
Right. Absolutely. I think it's a good starting place, though. I think that in the past, I think about before social media, trying to choose a surgeon, how limited the resources were for patients. So I think it's a really powerful tool. And again, that's why, you kind of go all in, because a lot of patients really benefit from it.
I agree. And I think it's something that you and I will both continue to do, because I do think that for all the let's say for the negatives that come in, there's even more positives that come in.
Definitely.
And there was even the recent study ASPS put out that social media has been really found to empower patients. So I hope that's what at the end of the day that we're doing is empowering people.
Definitely. And I think that both, obviously I'm a big fan of your content, and one of the reasons that I had enough confidence to pursue a page of my own and kind of put myself out there was what you've created. and I lost the rest of that thought.
Aw, thank you. Tell me kind of what you're hoping, like, what do you see as being the next step? Do you think, and this is, I haven't told her this question in advance. So, but social media is there. Where do you feel like might be the next step and the next way we reach our potential future patients?
I think things like podcasts. I think that, deeper conversations, and I'm trying to think what other forums. I feel like podcasts, YouTube, longer, just more information.
Yeah.
I feel like the one thing that's very limiting about Instagram or TikTok is the time limitation.
Yeah.
And
trying to get everything into a minute and 30 seconds is hard.
Trying to educate somebody in a minute is challenging. So I think the longer forums are going to be really powerful, and something that, is kind of a reach goal for me.
So what are your top 3 favorite procedures to perform?
Top 3 favorite procedures. Oh, that's tough. I feel like at this point I have, there's a lot of things that I like to do, but probably top 3, I absolutely love facelifts, blepharoplasty, and deep flaps.
It's an interesting mix.
It's an interesting mix. I think that the common thread, what really excites me is, again, like the detail-oriented surgeries where kind of millimeters make difference.
Absolutely.
And that carries true when, on facial plastic surgery, some of the facial surgeries that I do. And then also in microsurgery, the millimeters matter.
Will you explain what a deep flap is to our listeners?
Sure. So it's a method of breast reconstruction using a patient's own tissue. We take abdominal tissue with its blood supply, so with the little blood vessel, and then attach that blood vessel into a vessel in the chest to recreate the breast mound. Typically, we're doing this after a mastectomy or removal of the breast for breast cancer patients.
And when she's talking about microsurgery, these are like 2, maybe 3 millimeter vessels. So, and these are surgeries that Dr. Fairchild and I do together. So it's a long day, and we get a lot of questions sometimes about how we manage to do it.
Yes.
But my analogy is always, just like a marathon runner, you get used to it when you practice. It's the same with us with those type of surgeries, but they are very rewarding.
They're very rewarding. It is absolutely a marathon, and but it's really fun when you're doing it with a great team, and I really enjoy doing them with you.
I do too. So this is a question that I think is often asked more women than men, but still curious, is how do you manage your work-life balance?
Such a common question for me.
Yeah.
I think that there's probably never going to be a perfect balance. The way that I look at work-life balance is a balance over a period of time. I never expect that I'm going to have perfect balance every day of my life, every week of my life, every month of my life. I set goals, and I sacrifice, short-term fun things for ultimate, like, long-term balance. And so that's how I've always approached things. I think in order to reach those long-term goals that require a grind, you have to sacrifice, a fun weekend here or a night out here. But I think it's in return for an overall very fulfilling, fruitful, balanced existence.
I think that's a perfect answer, because my answer is usually like, I don't have a work-life balance. And it is because I'm working towards it. It's the same thing, is that I know that sometimes some of the sacrifices I make right now in the long run are going to help me achieve that balance. Right. I think it is hard to say that from the get-go you can have that. So it's just like anything else. You have to earn it in a little bit. It takes a little time, and having supportive family, having, supportive coworkers, all of those things kind of help you get to that goal eventually.
Definitely. And I think it's so important to realize everyone's situation is different. And people always ask me, like, well, why did you do things in the order that you did them? And it was because that's the way that I could get it done. Because are the tools that were in my toolbox. And I utilized the tools that I had, the resources that I had. But somebody else has completely different tools and resources. So that journey may look completely different for them. And the end point may be similar, but the journey is individual. So I encourage people not to compare themselves to other people too much, and not to try to exactly mirror somebody else's career and professional life, because unless you happen to have the same family members available, the same financial resources, the same, community resources, you will likely have to do things differently.
That's a good way of thinking it is. There's obviously always going to be people that you might strive to be like, but you can't directly, compare yourself to them.
Of course.
What's one piece of advice you give to a future student who has an interest in plastic surgery? We get students here all the time who come to observe us and watch. And I get asked that question a lot.
Sure.
And I think it's a difficult one. But if you had something for someone who's, let's say, college level, that's looking to maybe plastic surgery is my future, what advice would you give them?
I would tell them to seek out life experience. And I would say the decision has to come from within. Outside influences should not play a role in career choice or plastic surgery.
Yeah.
And I think
that
if you're driven from inside of you, then you make it happen. When you're driven by outside pressure, it's harder to perform when things get tough.
That's true. Because I think at the end of the day, we really love what we do.
Right.
And even when there's challenges, we love it.
Right.
And I always encourage people to remember that plastic surgery, while yes, there's glam to it, that's not our everyday lives.
Right.
There's a lot of long hours, a lot of hard work, a lot of school. And because we love what we do, we stay driven to keep doing it. But it's not everything that you see on TV. There's a lot more to it.
It is not.
So Dr. Fairchild, thank you so much for joining us today. Would you like to share your Instagram and TikTok handle so my listeners can follow you? Because I absolutely, like I said, love your content.
Absolutely. It's at Dr. Barry Fairchild, and it's Berry, like the fruit.
And that is her real name, and it's beautiful.
That is my real name. And if you're wondering, it is a family name. It's not the fruit, but yeah, it's a family name. But it's been a pleasure. Thank you so much for having me.
Thank you so much for coming. And again, we are both part of My Houston Surgeons, and we are proud to be a largely female plastic surgery, as well as ENT and sinus practice. So thanks so much for joining the Confidence Doc podcast. Stay tuned for next week.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.